Hello and welcome back to our channel. Coke or cocaine is a tropane alkaloid that stimulates the central nervous system. Because of its euphoric and gratifying qualities, it is mostly used illegally and for recreational purposes as an extract. South Americans also utilize it in medicine for a variety of reasons, while doctors in developed countries employ it as a local anesthetic. It is largely made from the leaves of two native South American coca species. The substance is taken by snorting it, applying it topically to the lips, dissolving it, and injecting it into a vein after being extracted from the plant and subsequently processed into powdered cocaine. Its street names include blow, coca, coke, crack, crank, flake, rock, snow, soda cot. Taking cocaine can make you feel happy, excited, wide awake, confident, and on top of your game. Cocaine affects people differently, but most users become chattier, more animated, while some become overconfident and arrogant, restless, and edgy. Cocaine can increase your sexual desires too, and some people take it to have more intense sex, but taking lots of cocaine can actually reduce your sex drive. Although cocaine is a popular recreational drug, many people are ignorant of its lengthy and occasionally horrifying history, as well as its hazards. Even though the majority of people are aware that cocaine is an addictive drug, there are many other facts about cocaine that could surprise you. In this video, we will be counting down 10 intriguing and dangerous facts about cocaine. Let us begin, shall we? 1. Cocaine's use in the medical community. A German scientist created cocaine in 1860, but doctors did not become aware of its painkilling properties until the 1880s. Karl Koller, an Austrian ophthalmologist, used cocaine to sedate a patient's eye in 1884. Cocaine, according to Dr. Koller, has potent anesthetic and vasoconstrictive properties that significantly lessen bleeding during surgical procedures. 2. Several famous addicts. Prior to cocaine, anesthetic had very few alternatives and was limited. As said before, the discovery of an intriguing chemical that may manage pain excited medical professionals. Sadly, they took cocaine without completely comprehending how it would affect their bodies. Doctors recommended cocaine between the 1880s and the early 20th century for a wide variety of illnesses and physical pain. This reduced pain, but it also led to a significant rise in drug addiction, which affected scientists, doctors, and even U.S. presidents. Thomas Edison, Sigmund Freud, Robert Louis Stevenson, and President William McKinley are a few well-known cocaine users. 3. Users are at an increased risk of a stroke or heart attack. Unfortunately, cocaine usage, even short-term use, greatly increases the likelihood that you may have a stroke or heart attack in the future. This is only because using cocaine has the ability to cause blood pressure to increase, heart wall thickening, and artery hardening. Of course, the more cocaine you consume, the greater the risk becomes. The likelihood of developing the mentioned health problems is noticeably higher for long-term users than for the normal individual. This means that almost no amount of cocaine is safe to use. Compared to sniffing cocaine, this danger is considerably increased by smoking or injecting the drug. 4. Cocaine is highly addictive. The potential for addiction in cocaine is one of the main factors driving the high level of long-term cocaine usage. The ability of cocaine to produce pleasure from even little doses is well known. Additionally, users may have feelings of invincibility or the belief that nothing bad can ever happen to them. The person will usually start to return to their regular mental state within minutes, and this experience is frequently brief. The user may experience anxiety, depression, etc. when gradually coming down from such an intense high. They could keep taking cocaine to re-induce the release of dopamine in an effort to get rid of this sensation. This kind of activity could last for hours, depending on the environment. Typically, the first use of cocaine occurs as a social leisure activity, but someone may become a persistent cocaine user with abnormal settings if they become addicted to the euphoric high it produces. People could start frequently using cocaine, for instance, before going to work, going to a public function, or even before leaving the house. In severe situations, a person can decide to consume cocaine rather than take care of other responsibilities, such as getting their kids from school. 5. Coca-Cola contained cocaine until 1903. You may be aware that Coca-Cola originally included cocaine. It's true that the well-known soft drink initially included very small quantities of wine and cocaine. Dr. John Pemberton, an American physician, first offered Pemberton's French wine coca in 1884 before switching to sugar syrup in 1886. Up until 1903, the cocaine remained. 6. Spanish conquistadors used cocaine as money. The extraction method required to create refined cocaine was not developed until 1860, thus the Andean and Incan populations did not consume it, but they did chew coca leaves to consume little amounts of it. In the 1500s, the conquistadors traveled to the New World and saw how the locals valued the leaves. As a result, in what would become South America, the Spanish used coca leaves as money. 7. It's possible to overdose. Most people frequently associate the phrase overdose with substances that are taken orally like pills or get injected like heroin. Since snorting cocaine is the most popular method of consumption, many people prefer to ignore the risk of overdose. However, there is a substantial risk involved with consuming a lot of it quickly. A cocaine overdose is most commonly accompanied by heart failure, brain hemorrhage, stroke, or seizures. If cocaine usage is paired with the use of other drugs, the risk rises much more. Because it can be more difficult to figure out how much cocaine you are using and how effortless it is to take too much at once, the likelihood of experiencing negative effects from cocaine use is significantly higher if you choose to smoke or inject the drug. 8. Cocaine withdrawal is serious. You are more prone to have withdrawal symptoms the longer you consume cocaine on a regular basis. Withdrawal is a severe condition to manage, especially with this substance. Concentration difficulties, severe sadness, suicidal thoughts, and muscular pains are among the primary symptoms. In extreme circumstances, withdrawal symptoms could jeopardize your life. In addition, those who relapse after trying to stop using cocaine usually binge on it. This leads to a scenario where their tolerance was lower than it had previously been because they had temporarily stopped using the drug, but the user could try to take a similar amount of cocaine to what they were used to, though. This has the potential to quickly result in an overdose or serious health issues. Dealing with cocaine withdrawal sometimes needs expert support. 9. Cocaine was legal until 1914. From the 1880s through the early 1900s, cocaine was often utilized as a medicine. But there was a huge push to limit its usage as people recognized it was seriously addictive. In 1914, the Harrison Narcotics Act outlawed cocaine. Cocaine was still used by doctors in the modern era, but alternative anesthetics have mostly taken its place now. Cocaine hydrochloride is still sometimes used as a topical anesthetic. 10. Long-term use can physically alter your brain. Numerous people are ignorant of the possibility that long-term cocaine usage may physically alter the brain. The decline of gray matter, which is partially in charge of processing information inside the brain, is one of the most visible impacts. Therefore, a reduction in gray matter will have a profound impact on cognitive ability. The way your body releases dopamine is also impacted by frequent cocaine usage. The dopamine surge brought on by this can change how your brain processes this neurotransmitter, and you could even discover that once enjoyable activities are now unsatisfying. Rarely, a long-term cocaine user would not be able to experience joy or thrill without the substance. And with that, our video comes to an end. I sincerely hope you found today's video interesting and informative. Don't forget to click the button below to like and subscribe to our channel. Smacking the bell icon will make sure you never miss an upload. Share this video to everybody, especially young people or anyone who is likely to get into these drugs. Leave your thoughtful opinions and ideas in the comment section below, and I'll see everyone again in the next one.